All right, here are 5 simple strategies for strengthening your list of questions. Now, this exercise will not take long, and I want you to get in the habit of doing this before every doctor's appointment or before rounds. And if you're already feeling overwhelmed, you've got too much on your plate, this is a great opportunity for you to bring someone else in on the support team and have them help you. This is an easy task, it's not going to take a lot, and they don't need a lot of training. In fact, you can show them this video and they can learn how to do it on their own. So here are the 5 tips. Number 1, I want you to look over your list. Let's say you have 15 questions for the doctor right now. I want you to look at all of the ones that start with do, is, are, can, all those closed-ended questions, and convert them into open-ended questions. That's step number 1. Once you finish doing that, I want you to look at all the closed-ended questions that you kept. It's great. It's fine that you kept closed-ended questions. And I want you to ensure that those closed-ended questions are very specific. Remember that closed-ended questions are great for getting very pinpointed information. So let's just make sure that you strengthen those questions and you're getting exactly what you need. Tip number 3. Now I want you to review that list of questions again, and I want you to do one of 2 things. You're either going to eliminate any that you feel are repetitive, you're just asking the same thing in maybe a different way, or you're going to combine questions that you feel like are very similar, just maybe asked slightly different, and maybe you can strengthen them by combining them. The goal of that is that we're trying to decrease this list because time is always limited. So we're trying to make the best use of our time with the physician. So if you can eliminate any, just cross them out, great, because they're a repeat. Maybe someone threw it in the chat and you're like, oh, we already had that question. Or you read 2 questions and you feel like it's kind of asking something similar. Can we combine them and strengthen it? Great, go ahead and do that. Tip number 4. Now I want you to go back over that list. Hopefully it's a little shortened. And I want you to circle any questions that can be answered by other medical staff, like nurses, the receptionists, the care coordinator in the hospital, or maybe even billing. To ask a physician about health insurance policies, they're probably not going to know the answer to that question. So make sure that you're asking questions to the physician that are geared towards your loved one's care. Okay. So you want to take those questions that now you've circled because they're not the best ones to ask the doctor and create a new list. And you can even make a little note as to who you think is the best person to ask. So now, hopefully, your list of questions for the doctor has shortened even more. And now the last step you're going to take is I want you to organize your remaining questions. At the very top, you're going to put the most critical questions. And then as you move on down, the last question is the least important question. It doesn't mean that it's not important. It's just out of all of them, it's the least important. This way, if you run out of time, you get your most critical questions answered first. This can happen in a hospital where there's emergencies. There's also emergencies in doctors' offices too. So, and then of course, insurance companies limit the amount of time that doctors can spend with their patients. So if that happens to you and you get cut off, at least you got your most critical questions answered first. Really important. All right, now it's one thing to prepare with strong questions, but it's another to ensure they get answered. So in the next lesson, we're going to tackle getting the answers to your questions. You got this, badass advocates.